Welcome, everyone. We're really excited here today at Connecticut Family Support Network. We are here with Tammy from Connecticut Department of Developmental Services, specifically the Children's Services Division. We are here to hear all about what's happening and what's new. Please keep your mics muted. We are going to have a Q&A section at the end of the session information. And then once the recording is up, you will get a link to the YouTube channel access to view the video. We're very excited to have her here, and by the amount of participants that have registered and come, it seems like we all feel the same. We want to learn more and hear from Tammy. So I just want to go over one last thing. If you don't want to come off video, come off mute when you ask your question, there is always the option of chat at the end, and we will be also sharing a survey at the end. So when we log off or you log off, a pop-up should come up, and it should have about 6 or 7 questions. That's really important because it helps us to see what future workshops you'd like and to understand what you thought of the information, so we can keep and continue bringing you workshops that matter to you and bring you information that you want to know about. So with further ado, I want to welcome Tammy. Thank you, Tammy, for joining us today and taking time to come and talk to community and have a conversation today. So I will hand it over to you.
Thank you. Hi, everybody. I'm Tammy Venenga. I'm the Division Director of Children's Services. Just wanted to introduce Kendall Fenton, who is here as well. She is the Education Service Specialist at DDS. So that's Kendall.
Hi.
She also helped get the training together and does many trainings with school districts. So if you hear this and think it's important for schools to know, she is your go-to person. She goes out to schools, makes sure social workers and other people have heard about what DDS is doing. First and foremost, I want to thank our commissioner and our deputy commissioner for knowing that children's services is very important. And having a children's services division, this is the first time that this has happened at DDS. So we've been around with our case managers about a year. I started about 1.5 years ago for children's services. So this is just a brief summary of what we're doing and why. I think. So to be eligible for this Children's Services Division, you have to be eligible for DDS. So keep that in mind. So to get supports and services from the DDS Children's Services Division, you need to be eligible for DDS. I'm not going to go over all of the eligibility criteria, as I'm sure you are aware of what they are, but I will also share this PowerPoint so you can use all the links and get more information if you need. One of the things that is available for everybody who's with DDS is our helpline. Our helpline is able to connect families with our respite centers, with Camp Harkness passes. We have family grants that many families use. And we all know camp is coming up already. People are signing up for camps and getting those family grants in for to help offset the cost of grants. It's already taking place. So that can all happen through our helpline. We have family support workers with our helpline that can do short-term support for families. And we also have transition advisors for when kids are aging out of school and graduating from school and going into day program services. They also have clinical teams, speech, OT, PT, psychologists, behaviorists, nurses that are also short-term and can provide some short-term intermittent supports to families. And sometimes that's all a family needs, is this limited support. And then sometimes families need more. As you know, we are a Medicaid agency. So if if a family does apply for children's services, we do have them apply for Medicaid to make sure they're in the waiver. So we get federal reimbursement. And we have 3 different waivers: the day in employment, the individual and family support, and then the comprehensive support waiver. So we just always want to mention that because some families prefer not to apply for Medicaid, And that's a requirement for Children's Services. It is not a requirement for the helpline. So you can get those services from the helpline and not worry about having to be on Medicaid. Our division does a lot of work with transition planning for those children that have services from other state agencies. So a child that was placed out of the family home by their LEA to make sure they received a free and appropriate education in the most appropriate spot for them are in our division. Those that are with DCF due to a DCF commitment are also in our division, and we do transition planning for them. Those that get voluntary care management because a child has mental health supports that are needed, that's with voluntary care management. So we work with transition planning for all those individuals that have some sort of residential funding from another state agency or our state agency. Our program specifically, our Children's Services program, is an in-home support program. DDS cannot license children's group homes. Only DCF can do that. And we have no children's group homes. So for us, this program is an in-home support program where we try to keep the child in their family home and in their own community. So for our program, kids in our programs are anywhere between the ages of 8 to 21. And there has to be a demonstrated need that's above and beyond what can be met with insurance, which it can be either a medical need, a physical need, or a behavioral need. One big thing is we go to 21, but they have to be found eligible prior to the age of 18. So just keep that in mind. After the age of 18, at the age of 18 or over, if someone needs supports and weren't in the Children's Services division, they can go through the helpline and see if a Pratt request can go forward for that support. Some of the things that are available through our Children's Services program, we have two of our own respite centers. It's very exciting. We have one in Enfield and we have one in North Haven, 4 beds each. They're open every single weekend. And it's great to make sure that these respite centers are specifically for children and they do appropriate grouping. So an 8-year-old won't be there with a 20-year-old, but you know, these respite centers allow families to get respite more frequently than what our regions have available to them, because that's usually only quarterly or twice a month. This one's a little bit more. Most families most of the individuals in our program, they get in-home supports, personal supports, and behavioral supports. I'm just saying those because those are the most popular. It's not the only services that are available because they're on the waiver. So they're entitled to waivered services. But again, these are our most popular. The people that cannot come into the kind of our exclusionary criteria is those kids that aren't in school, aren't yet enrolled, or not in a consistent education, or where the family is asking the school to place the child out of district, out of their home, not out of district, out of their home. And that's because we want to make sure the school and the education that a child is getting is first and foremost on everybody's mind, because that is what we want for our kids, to get the best education they can. If they're not living in their family home, they're not eligible. If there's an open case with DCF, we don't make them eligible for ours because DCF is putting in those needed supports. Again, same thing with juvenile justice. If they have an open case with juvenile justice, they're not open with us because the juvenile justice system is putting in those services. And if a family is requesting out-of-home placement, they're also not eligible for us. Like I said, this is an in-home support program. To apply, you complete and submit all the forms and stuff we ask you for. We make sure that you apply and accept all insurance-based services. We want to make sure families actively participate in any treatment or any support services that are taking place in the family home to make sure we have good carryover, make sure everybody is approaching the situation or what the need is in a consistent basis, again, to best support the child. All services will occur in the family home or within the family's community. It's not always in your house. It could be outside in the family's community. The family doesn't have to go. This isn't, the family has to be there, but we just want to make sure it's all within the community. We want the individual to be known. We want them to be recognized. We want other people to say hi to them on the street because they've seen them, outside of their family home and maybe saw them at the library or at a baseball game or, at a high school football game, that they're known and they're liked and respected. We have 3 different regions. Each region has its own helpline number. That's how you would first ask for children's services. We also have a general email box that's listed here. Again, you'll get these PowerPoints. It'll be there. You can just email us directly. Someone will get back to you. And then again, Kendall is our education service specialist. If you believe that she would be beneficial to come to your school or any other community places that you would like for them to know about children's services and DDS, she is your person. She's good. She knows our services. She knows how to hook people up together. So Kendall is the person for that. We work very closely with Carelon Autism Services. So for those kids that have autism, it is required that you get those Carelon Autism Services. They're insurance-based services. That always has to come before what DDS does, but we work together. So you get those Carelon services and get that in-home clinical support you need. And maybe you get some respite hours from us. Maybe you have a budget for respite. Maybe you have some wraparound services. It's hard to say exactly what services look like because we individualize it. It's what is needed to meet the needs of the family. Those kids that get Carelon Autism Services and maybe not even with Children's Services, again, we team with them to make sure those services don't drop off when they're an adult. Because these services end at 21, we make a projection to make sure residential supports, in-home supports can continue after those Carelon Autism supports end at 21. So I work very closely with them. We have a shared list. We really work together. We also work together with voluntary care management. Voluntary care management, or VCM, is a subcontract of DCF. When DCF used to have voluntary services, this is now DCF's voluntary services. So for those kids, excuse me, that have mental illness, mental health issues, substance abuse disorder, those kids we make sure go to voluntary care management because that's their specialty. And we want to make sure the individuals are matching with the most appropriate services. Same thing here. Voluntary care management ends at 21. We work very closely with them. We have a shared list. We take over at the age of 21 when they close. So again, working very closely with them. So we know the families that they're working with that are also eligible for us because we want to make sure we have really good partnerships. And then here's a bunch of agency links that we want to make sure people have, and even more resources. And then that's it. That's the end of the presentation. So that's what Children's Services does, who we work with, and what we try to do for families. So I'm going to stop sharing because then maybe I can see some faces.
Thank you, Tammy. So I want to thank everyone for tonight. I want to thank you, Tammy and Kendall. Kendall was great at looking at the chat and answering questions and giving support. So thank you for that. I appreciate that very much.
No
And
problem.
I hope you all enjoyed tonight's conversation. And hopefully if any of you have Children that are 16 to 21, you'll join us next month for the Connecticut Youth Leadership Project that's going to talk about the program that they have every year for individuals 16 to 21 with disabilities. And that's, you know, physical, developmental, leadership disabilities. It's a great program. So hopefully you'll join us next month for that. So thank you, thank you, thank you. Thank you, Tammy.
Thank you
Have
so
a
much
great
for
night,
the invite. I really appreciate it.
Thank you for coming. We had a great time. Have a great night, everyone.
Bye, thank you.
Bye. Thank
Bye-bye.
you.